Let me invite Dr. Jayaram. He is the medical director of Precise Group of Hospitals. He will be talking on Femto LASIK.
Good morning, all. I thank Dr. Kala for inviting me. Today I'll be talking regarding our experience with Femto LASIK. So as already described, LASIK is the most commonly performed refractive surgery worldwide. But recently Femto lasers, after its introduction in 2001, it's around 10 million cases have been done till now. That's what the data shows. So femtosecond laser is an infrared laser with wavelength of 1053. Actually the pulse duration is the difference. Actually YAG laser is also a infrared laser, but the pulse duration is in nanoseconds. But when it comes to femtosecond range, the amount of collateral damage due to the cavitation bubble decreases. So the general principle is photodisruption. The laser energy results in plasma formation, and the expansion of the plasma creates cavitation bubbles, which separates the tissue plane. Excimer laser, as you all know, is photoablation, which sculpts the cornea. So different femtolaser platforms use different pulse energy, duration, frequency, applanation surface, laser delivery pattern, type of flap creation. So we are using Femto LDV of Zymer, its latest model Z8. So to compare between Femto LASIK with versus microcatome LASIK, it gives better control of flap diameter, flap thickness and hinge width, hinge position flexibility, lower incidence of epithelial ingrowth, few flap related complications, that is one important factor, and improved visual outcomes due to lesser induction of higher order aberrations. So a lot of studies are there with which shows better thickness predictability, fewer higher order aberrations, a better contrast sensitivity, and increased T-butt. So in LASIK, it's the flap is a meniscus flap, and in Femto LASIK you can create a uniplanar flap with better thickness predictability with not much of variation. That's around maybe less than 5 microns. So our laser machines are Femto Z8 and MEL80. So this is the window showing the different flap parameters you can manage. You can adjust the flap thickness, flap diameter, then the cut of the edge, then the energy of the bed and side cuts and all counts you can regulate. This is a case. So you can, it's a 9 millimeter flap with this is the bed creation. Then it's a side cut. The duration is around 25 to 28 seconds. Then as you can see here, you can lift the flap. It's pretty easy due to its high, low energy, high frequency. The bed is very smooth. Then you can do the excimer and then complete the procedure. So complications are less with Femto LASIK. What I have experienced more of a few cases of suction loss in the initial cases. Vertical gas breakthrough and opaque bubble layer can happen, which will create problems. So I have done 244 eyes with a mean age of 28.4 years. 96% of eyes achieved 20/20 vision. None of the patient required retreatment on another date. Complications, as I mentioned, was suction loss. In the 3 patients, we could reapply with increased diameter and greater depth. The one had a difficult flap dissection that I will show you. It's the next case. 32-year-old female patient with minus 3.5 2 cylinder and left eye minus 2 with 2 cylinder. So actually, due to a mistake by the technician, the initial cut was made with a very low energy, so we couldn't elevate the flap. The second cut was made with a larger flap with a deeper 130 micron thickness, and initial flap was attempted with 100 micron. As you can see, the flap, it's very difficult to elevate. You can see the struggle. The right side, you can see a tag also. So after a little struggle, I could remove. Then I could see a tag. I reflected it and did the excimer. Then I could make out that the 100 micron, 130 micron, the tissue in between was partially dislodged, and I removed it from the undersurface of the flap, which was partially adherent to it. Then it was reposted. Next day, patient vision was 624. After 1 week, it came back to 6.6, and the topography was normal. So to conclude, use of femtosecond laser has only added to the beauty of LASIK with better visual outcomes, greater quality of vision, higher accuracy, and lesser side effects. The excellent outcomes of femto-LASIK presents a formidable challenge to even newer procedures of flapless refractive surgery, which is recently gaining popularity. Thank you.
Thank you, Dr. Jayaram. From